It would be obvious that something was wrong if a rambunctious puppy or kitten suddenly became lethargic. But a mellow adult dog or cat may seem normal when it's actually energy deprived. Therefore, lethargy is often overlooked as a first symptom of diabetes. More noticeably, the cells being starved for glucose causes the animal to feel a constant sensation of hunger. The term used for increased hunger is polyphagia. Despite an increase in food intake, diabetics will begin to lose weight. This is because they are not able to utilize the glucose that is derived from food. Instead, the body begins to burn fat stores in order to survive. Because obesity is a contributing factor in the onset of diabetes, many diabetics will present as overweight patients that exhibit unexplained and sudden weight loss. The elevated levels of unused glucose in the bloodstream, on the other hand, cause more significant symptoms. Increased thirst and urination are referred to as polydipsia and polyuria, respectively. Furthermore, when blood sugar levels reach a threshold, glucose will begin to spill over into the urine, becoming food for bacteria. Ascending urinary tract infections are very common in diabetic animals, causing urinary accidents to be a very common symptom. Many diabetic patients are first diagnosed when presented at the veterinary hospital with the complaint of inappropriate urination. In diabetic dogs, cataract formation occurs in almost all cases, even after treatment is pursued. This does not occur in cats.
Cataracts are an increased opacity in the lens of the eye, impairing vision.
Cataract formation in a relatively young dog makes them a suspect for diabetes mellitus. In summary, diabetes mellitus is an inability of cells to properly utilize glucose as a primary source of energy. Insulin plays an integral role in this delivery. A deficiency of insulin is not the only cause of diabetes. Patients may develop a resistance to the mechanism of insulin. The symptoms of diabetes may be vague and subtle at first, progressing to an obviously unhealthy appearance of the pet. Lethargy, increased water consumption and urination, weight loss despite an increased appetite, and early cataract formation in dogs are all symptoms that describe a diabetic pet. Terminology associated with diabetes: glucose, the basic unit of fuel utilized by cells for energy; hyperglycemia, increased blood levels of glucose; type 1 diabetes mellitus, a reduced production of insulin; type 2 diabetes mellitus, a resistance to the mechanism or activity of insulin even if insulin production is adequate; lethargy, decrease in activity due to fatigue; polyphagia, increase in appetite; polydipsia, increase in thirst;
Polyuria, increased urination; cataracts, increased opacity in the lens of the eye.
In Part 2, we will discuss the diagnostic tests used to confirm diabetes mellitus and stabilizing the presenting diabetic patient.